In the current video, I'm going to explain about the topic of cellulitis. It's a nursing and medical presentation. In this presentation, we will have an overview of the disease and we will understand how to do assessment of the disease and how to treat and how to prevent the condition. So, typical findings about whoever having the disease at the site, they will have redness and color change, and they may feel warmth, and they will have swelling and pain and tenderness at the place where at the region where they have the disease. We will see it will there will be a different redness, swelling, warmth with pain and color change appearance in the site where the individual develops the disease. So let's begin. So, what will be the learning objectives of this topic? In this topic, we will define what cellulitis is. We will understand how its pathophysiology exists, and we will explain about that. We will identify what will be the causing factors and what will be the risk factors which may lead to the disease. We will understand what clinical features we will see in the patient who are having the disease, and we will also understand how to assess the disease and how to diagnose the condition and how to do differential diagnosis, how to make it different from other injuries and other diseases because of that redness may be present in the patients, how to differentiate the disease from other conditions, and we will also discuss the treatment and what will be the nursing management for the cure of the disease and what can be the complications and how to prevent the condition. So let's begin. Let's begin with the definition of the disease. Cellulitis is a bacterial infection which involves the deeper layer of the skin and subcutaneous tissue. So we should not misunderstand it with the viral disease. Cellulitis is a kind of bacterial disease. So it commonly produces localized redness and color change at the site where the individual develops disease, and there will be warmth, swelling, and pain and tenderness at the site of the disease. The lower limbs are the most common sites which get affected with the disease because they are more prone to get contacted with the bacteria, and but cellulitis can occur anywhere in the body because if there is present nowadays infection present everywhere in the everywhere can present everywhere in the in the place, in the atmosphere way or environment, where it also depends on the environment in which the patient and the individual is living, and at any place of their body they can develop the disease. So, first we will understand what is the skin anatomy, which is we need to have an idea about. So, our skin is mainly made up of three layers, and deeper skin involves subcutaneous. Deeper skin involves subcutaneous tissue. So first we will have dermis and later on we will epidermis. First the topmost layer is epidermis, then we will have dermis layer, then beneath that we get subcutaneous tissue. It is a tissue which is under the part of the skin, but it is the most deeper part of the skin. So the epidermis forms the outer barrier of our body or skin, and the dermis contains vessels, nerves, and skin appendages. Dermis will have all the vessels and nerves and skin appendages. Then the subcutaneous tissue contains fat, connective tissue, and larger vessels. Subcutaneous tissue will have fat, connective tissue, which means blood also, and larger vessels, blood vessels. Also, cellulitis primarily involves the deeper dermis and subcutaneous tissue. So in the epidermis, we don't find the disease of cellulitis. Cellulitis is seen in dermis and epidermis. So now we will see how infection enters our body. Infection usually they break the skin, bacteria enter and multiply in the tissue, dermis and subcutaneous tissue. So bacteria usually enter through a break in the skin. It can be because of cut or any prick or any friction or anything. If the patient mostly they scratch their skin or they have itching sensation, then also it will break the skin, and it can lead to break in the skin, and it prone to bacterial entry in the deeper layers of the skin. The entry point includes cuts, ulcers, bites, punctures, surgical wounds also sometimes, and because of eczema and fungal infection. Due to fungal infection also, it leads to the breakdown in the skin, and it may lead to cellulitis. The skin defect may be so small that the patient does not notice it. And sometimes what happens, sometimes the patient may not notice much break in the skin, but it causes bacteria to enter into the deeper layers of the skin and produce the disease. So, because these are the main causes and ways how the infection enters the body of the patient and develops the disease. So now we will understand what are the common causative organisms which cause the disease. The disease causing organism is Streptococcus pyogenes, and other streptococci are important causes. Streptococcus aureus can also cause cellulitis, particularly when purulence and abscesses present. Because some patients, because of purulence and abscesses there in the patient's body or site, if at the and Streptococcus aureus and Streptococcus pyogenes and streptococci are the most common bacteria which cause the disease. The organism profile can vary with exposure, host, factors, and local epidemiology. So it means that the patient will get the disease. It also depends on the organism profile, means how potent and how effective the bacteria is, and it also depend and what kind of exposure the patient is having, infectious exposure or bacterial exposure the patient is having, and it also depends on the host factors, means the person who is getting the disease, how much sick he is, how effective their disease immunity or disease factors are there, what kind of lifestyle they have, we can say, and what kind of immunity they have, or what kind of um, mm, how much they prone to the disease, because that also affects and what other diseases the patient is having, this also affect the disease development in the patient, and local epidemiology, and how much at the local area, how much the particular disease is relevant at that geographical condition or the environment, that also affects the person will get the disease or not. So now we will see and understand pathophysiology of the disease. What happens? The bacteria invades the tissue, and it will trigger the inflammatory response. Because of the inflammatory response, vasodilation occur, and immune cell recruitment. Then at the site, immune cells get activated, and then because of that we will see redness, heat, swelling at the site of infection. Local vasodilation. Why local vasodilation happens? Because it will increase blood flow, producing redness and warmth in the body, and because of increased vascularity permeability, it will cause edema and swelling at the site, and immune cell recruitment contributes to pain and tenderness. Because of that reason, it may also cause pain at the site and tenderness at the site. So, what will be the clinical appearance? So, if cellulitis happened at that site, at the in the patient, so where the patient is having cellulitis, there we can see acute and uh, expanding inflammation. In that area, we will see there is a sudden, acute, and expanding inflammation, increased inflammation we can see at the site. Borders are often poorly defined because here the inflammation occurs due to increased vascularity at the site. So at the borders, they are not precise. They are poorly defined, but we will see inflammation where cellulitis happened, and the skin get we can see warmth at the place of the disease, and we see it is swollen and it is tender. Blister and the orange appearance may occur in some cases. In some cases, we can see blisters also. Usually, they are not present in cellulitis, but in the worst cases, and if some other reasons also, blisters uh, may present at the site of the disease. So uh, here we illustrated what will be the clinical appearance of the condition. So here we see redness, color change. Sometimes redness will be there, and sometimes color change also may be present. But we should be able to differentiate it from the blunt injury of the site at the um, um, we have to do differential diagnosis at the time of at that time. If there is a blunt injury and because of that blood clot happened between under the skin, then it may be not because of the bacterial infection or cellulitis. It can be because of the injury. But if it there so we have to identify for the infection at that time, and then only we can diagnose it as cellulitis. So now we will understand what are the systemic manifestations. So in the patient may have fever. Sometimes chills may occur because there is a bacterial infection. Malaise or flu-like symptoms may occur, which also accompany with a more significant infection. Sometimes lymphangitis and regional lymphadenopathy can be present in the patient, and if it deteriorates, it can develop systemic toxicity also and can cause severe infection. So in this slide, we will understand what are the risk factors which can cause the disease, and skin barriers. What are the skin barriers? So cuts, abrasions, punctures, wounds, insects or animal bites, eczema and other chronic diseases can cause the disease. Athlete's foot, tinea pedis can occur in the patients. Surgical wounds or ulcers also can also develop cellulitis. So what are the risk factors? Here we will see what are the host factors which can cause the disease. Chronic edema, or if the patient is suffering with lymphadenopathy, if the patient is having venous insufficiency because of some reason, the patient is more obese, the patient have a lifestyle of reduced mobility, if the patient is having impaired immune function, or diabetes can increase, or diabetes that can also lead to cellulitis. Mostly diabetic patients have the complaints of cellulitis, develop the disease. So what are the most common sites where cellulitis can occur, the disease can occur? Lower legs and feet are frequent sites where cellulitis happens. and hands and arms may also get affected in some patients. Face and periorbital regions, periorbital regions also develop the disease, and which require precaution and caution. And proper hygiene needs to maintain that can avoid most of the disease. And always assess for a portal of entry and the extent of involvement. We have to see portal of entry, how much, where from where infection happened. We have to see there for that, and how much infection happened, uh, um, which cause the disease. So, assessment, here we will see how to assess the patient who developed the disease cellulitis. So, we have to ask the onset and speed of progression. We have to ask the patient when they developed the disease, and how many, and how it how much, how in how many days it's developed to the shown complaint or observation. Then we have to how in how many days they develop the disease. Then we have to ask the patient whether they are having pain, fever, or chills or malaise. Then we have to ask did they have for the differential diagnosis, did they have any previous injury, bite, infection, surgery, or wound. Then we also can take a previous history about cellulitis. Was this is a chronic disease? Previously, they took treatment of the disease, or what? We have to ask. And then we also have to ask whether they took previously any antibiotic medications regarding the disease, or any other medications they are taking for the comorbidities. So these are the this is the history we have to take from the patient, um, to who is having the disease. So in the examination part, we will inspect any color change at the site the patient is complaining, having the condition, and we have to see whether there is any kind of swelling, blisters, wounds, or drainage is present. Then we have to palpate for the warmth and tenderness and fluctuance, and we have to check pulse of the patient, and pulse sensation and limb function. Then we have to assess regional lymph nodes and uh, lymphagenetic streaking, if present in the patient. Then we have to measure and document the affected area in the examination. So, marking the border. Well, as even though the border of the cellulitis infection present is not precise or clear, we can outline how much we can outline and assess how much area the infection at is present, and the disease is affecting how much to the patient body region, that we can assess, and we can make a border. The other skin marker can be used to outline the edge of erythema when appropriate. Date and time, the marking and redness, and reassess for progression. Then if we also can assess progression of the disease, we can see whether the disease progression is there or not by marking. If next time if we mark, then if the disease progressed, then we can say the bacteria is multiplicating and increasing the condition in the patient. That also we can assess, and we can assess the progression of the disease. If it is reducing, then we can say that the immunity of the patient who developed the disease is more effective, and they are their body is fighting against the disease. And if we see progression in the condition, then we find that the immunity their body need further medication, so they get cure on the disease that we will identify by assessing the progression of the disease. And we will see a rapid extension beyond the marked border suggests worsening infection. So if rapid extension we uh, see from the marked side, then we can understand that it's a worsening infection, and medical management required at that time. So this is an adjunct to clinical assessment, not a substitute for it. So we can do this, but patient don't come to the physician repeatedly. So we can do this assessment, but immediately patient come. But whenever patient come to the clinic, they come for the medication and cure of the disease. So it is the adjunct to clinical assessment, not a substitute for it. So now, how to diagnose? How to diagnose cellulitis? Cellulitis is usually diagnosed clinically from the history and physical examination. So when we take a history of the patient and we physically examine the patient, then we will understand whether the patient is having cellulitis. Routine blood test cultures are not required in uncomplicated cases. When the case is not much complicated, then routine blood tests may not require. Investigations are guided by severity, atypical features, and suspected complications. If suspected complications are there and severity is there, then we can prescribe the investigations to the patient. So we have to take history and skin. We have to examine the skin. We have to assess the severity. We look for source and portal from where the infection is occurring. Then start appropriate treatment. We can start treatment. Test only when indicated. When required, we can ask for the investigations also. When culture may help. Culture are not routinely needed for a uncomplicated cellulitis. Cultures are usually not required when this is a uncomplicated cellulitis. This may be useful when severe systemic illness is present, and when there is a unusual exposure, or when suspected atypical organisms. Then when suspected atypical organisms, then culture may require. Purulent material, when present, can be sampled to guide the therapy. When there is something else, or some abscess or some other purulent material present at the site, then we can take the sample of the uh, sample or biopsy. We can sample of the purulent material, which also guide the therapy. So here, what are the differential diagnosis? Other skin infections we have to differentiate from cellulitis, which also can cause tenderness, swelling, warmth at the site. So we have to differentiate those things from cellulitis. What are the other differential diagnoses? Are deep vein thrombosis, DVT may also be there, which is different from cellulitis. Venous stasis dermatitis can be present in the patient, and uh, other contact allergic dermatitis may be present. Erysipelas, abscess, and other soft tissue can be present in the patient. And necrotizing soft tissue infection can also present in the patient, which are different from cellulitis. Cellulitis involves deeper skin and subcutaneous tissue, and it is often and distinct have indistinct border. Whereas in erysipelas, it is more superficial and typically has a sharp, demarcated, raised borders. Both can produce redness, warmth, pain, and systemic symptoms. So cellulitis develops usually it is unilateral. It will produce warmth and tenderness, and it is acute in condition. Whereas DVT in the DVT also we will have swelling, pain. Consider risk factors. No primary infection we see in this condition. And if it is venous stasis or dermatitis, then it is um, bilateral. We will see scaling and hyperpigmentation at the site, and in erysipelas we will have it will be more superficial, and we will see sharply demarcated raised borders at the region where area where the patient is developing the disease. Here in this slide, we will try to differentiate uh, cellulitis. Uh, versus DVT. Cellulitis and DVT both may cause unilateral swelling and pain, whereas in cellulitis we see warmth and tenderness and inflammatory skin changes, whereas in DVT it requires thromboembiotic risk assessment, and we have to see what are the appropriate diagnostic pathways for DVT. So we should not assume that any swollen place, skin area, is cellulitis. We have to differentiate it from DVT also. Now, here we will see what are the main treatment principles to treat the individual suffering with cellulitis. Antibiotics are the main treatment for bacterial infections and bacterial cellulitis. As we know, cellulitis, the main causing organism for cellulitis is Streptococci bacteria. So, antibiotics are the main principal treatment given to the patients who are suffering with the disease. And we also decide how much medication should be given to the patient according to the severity, purulence, and past allergy histories, and what specific organisms cause the disease, or after seeing the after taking the local guidance, we can choose the choice of drug to the patient. Mainly oral therapy with medication tablets we provide to the patient. It is mostly given to the patients who don't have more severity, or which is not much complicated. And if in severe infection is present, then we can advise the patient's IV therapy also, or in some cases when the patient is not able to take oral medication, then we can give them IV therapy. So, for here we will see what are the antibiotic, what antibiotic therapy given to the patients who are suffering with cellulitis. Uh, the common guideline options for non-purulent cellulitis include agents active against streptococci. So we give the medication to the patient which decrease the streptococci population in the patient body, and examples may include cefalexin and other guideline directed beta lactams. Alternatives depend on allergy and clinical context. So we have to ask the patient history, and we have to ask whether they are allergic to any specific antibiotics, and according to that we can give medications to the patients. MRSA coverage is considered when specific risk factors or purulence is present. When more severe cellulitis is present, then MRSA coverage is considered. So we have to follow local antimicrobial guidelines also, and we have to consult to the uh, local prescriber also for any direction if they want to provide. So, what is the support management given to the patient? In this slide, we will see what is the support management given to the patient. We have to ask the patient to elevate the affected limb because it will reduce the swelling in the patient's particular region where they are suffering with cellulitis. We have to provide analgesics and antipyretics also because the patient, because of infection, the patient may have pain at the area because of inflammation, and it is also may lead to increased body temperature and fever. So we to reduce that we prescribe analgesics and antipyretics simultaneously in the therapy with antibiotics. So we have, and then we have to ask the patient to have a proper hydration. If they tolerate, they can do mobility of the particular region or affected region. And we have, and in general examination visits, we have to see whether they have any wounds, edema, or underlying skin disorders are present. We have to assess that, uh, and after giving all medical and supportive management, we have to reassess for the patient response, whether they are feeling comfort, they are reduced, they are feeling better. Then that we have to ask to the patient, and we have to move accordingly. Now, what nursing management provided to the patient? We nurses monitor vital signs and systemic status of the patient. They assess and document skin appearance, pain, edema, and progression if present in the patient. We have to administer antibiotics safely, and have to observe any adverse reactions because of antibiotics the patient develops, and inform for the change of antibiotics if required. Wound care and skin care should be provided to the patient, and the patient should be educated about adherence and any warning signs if present. Patient education. Every patient require in a certain kind of education in the clinic because they are unaware about the disease conditions, and they want to know how they get cured and how much time it will take for them and what they have to do for all these things. So required patient education should be given to the patient for their therapeutic care. So we have to explain the patient whatever the prescribed antibiotics given to them, what their course is, and we have to ask the patient take this medication as prescribed, and uh, what their effect can be on them, that we have to educate to the patient. We have to ask the patient keep the wounds clean and protected because patient is the person who live with their disease, so they are the most important person who can keep their wounds clean, and protect them from the further infection. So we have to educate them to do so. We have to ask them avoid scratching, and do stop doing a further skin trauma because it will break down the skin and will lead to further entry of the infection in their body. We have to ask the patient to review for the symptoms if they get worsen, or if they fail to improve, then also come for follow up. We have to ask them, and we have to teach them how to reduce the reoccurrence risk. So once a cellulitis patient treated, again after a few days or few months, they develop the same kind of symptoms or infection in their body. So we have to teach them try healthy habits and precautions so that reoccurrence reduce. So after this, we will see what can be the complications of the disease. Complications of the disease means the disease, if not may lead to further complications if not treated properly. So, what further severe complication can occur in the patients who are suffering from the cellulitis is that they can develop the bacteremia and sepsis in their body. They can form more abscess in their body or body region. They also can develop lymphangitis. They further can develop osteomyelitis if it reaches to their um, bones, and septic arthritis also can occur, and necrotizing soft tissue infection can occur in the patients who are suffering with the disease, and further reoccurrence of cellulitis or a chronic edema also can develop in the patients. These are the complications which may occur in the patients who are suffering from the disease. So these are the red flags, urgent escalations. When here we have to take immediate action if the patient produce particular these symptoms of uh, these symptoms, and further escalation and intensive care required to the patient. If rapidly spreading redness is seen, severe pain is seen, high fever, rigors, confusion, dizziness, and hypotension is there, then or rapid heart rate or breathing is present is developed in the patient's skin change to purple or black, or tissue necrosis we see. Then or periorbital and facial involvement develops in the patients, or necrotizing infection or sepsis is present, then we have to take uh, uh, escalating care, emergency care to the patient, give emergency care to the patient, and further incentive care required to the patient to control the critical condition. So here we will see what is the how to prevent the disease. For the prevention of the disease, we have to ask the patient to cover their cuts, clean their wounds promptly. Then, if anybody is having athlete's foot, then they should get treated for that. And other skin breaks are there, then also that should be treated. We have to ask the patient moisturize the skin or moisturize the cracked skin also if present. We have to ask the patient manage chronic edema and venous lymphatic problems. If anything they have, they get treated for that. And we have to ask the patient to protect their feet, legs from injury, and seek early care if infection is seen. So in this particular topic, we learned about what cellulitis is, and we learned that it affects the deeper skin and subcutaneous tissue. We understood how to diagnose the disease, and how to do differential diagnosis from other conditions. So we understood that how to use appropriate antibiotics, which reduce this risk of the disease and reduce complications. We also learned what nursing assessment is required in the patient to treat the disease. So how much monitoring we also understood about. We also learned about limb elevation required in this particular disease. We understood that how what patient education should be given to the patient, and how it is important. We also learned that what can be the rapid progression, and how to escalate the condition, and for further treatment if severity is present and systemic toxicity is present. So this is the topic today we learned about cellulitis. Hope you enjoyed the topic. Thank you.